It can take a long time to recover after a stroke. People who have had a stroke often have problems that can affect their daily life. Some of these will improve over time, but others may not change. The problems differ from person to person. Common problems include difficulties in speaking, seeing, thinking, understanding, mood, moving, looking after themselves, including washing, dressing, eating, and drinking. The stroke patient will need help to avoid further problems. It is very important that a person who has had a stroke is encouraged to do some of the activities they could do for themselves before the stroke, even if it is difficult at first. This will help the person to recover from their stroke. There will be some things that the person may never be able to do, but other things may be possible and will get easier over time. You may need to help your relative to do these tasks and change how these used to be done. Your relative may need help to do many of the things they used to be able to do for themselves. Placing a chair to which they are to be transferred at an angle of 30 to 45 degrees from the bed. Before the lifting, ensure the wheels are locked. By lifting them from the buttocks while their arms are wrapped around your neck. Make sure to place the feet apart to maintain balance. Turn them onto a chair. By lifting them up while holding their unaffected arms, provided your relative is able to bear weight through his affected lower limb. The main aim is to allow your relative to use his body for the movement by providing just enough assistance to avoid any complications like a fall or injury. Encourage your relative to wash and dress themselves. It is difficult to start with. They will need more help from you. Your relative may need help to brush their teeth. You may need to help them or do the tasks for them. It is important to wash to prevent problems with skin becoming sore and to avoid infections. If your relative has problems with feeling their affected side, check for cuts, bruises and sores during their wash. Regularly moving will help your relative to recover after stroke and helps to prevent skin becoming sore or painful joints and muscles. Before the lifting, ensure the wheels are locked. This can be as simple as helping them to stand up for a short while regularly, or to reposition themselves in a chair. Your relative may need help going to the toilet. Think about how they are able to get to the toilet. Think of ways to help the person be more independent. For example, loose-fitting clothes that are easy to move with one hand, something to hold onto to steady themselves while getting on and off the toilet, and clean themselves afterwards. Important that the person is encouraged to do simple, gentle exercises, such as moving arms and legs, whilst in the chair, and any specific exercises physio. Trunk movements. Active assisted limb movements. bridging exercise. Active assisted limb movements. Many people have difficulties with their vision following a stroke, and may not be able to see things placed at one side of their body. Need to be aware of these and make adjustments. Approaching from the side they can see and placing items in the sight. Need general advice on supporting communication, for example practice, quiet, calm, patience, encouraging the person to try to say the word rather than speaking for them, using writing, etc. Having a stroke is a life-changing event, and there are many things that the person with stroke and their family have to adjust to, and challenges to be faced. It is common for the person who has had the stroke to be sad and anxious. This is part of normal adjustment to your different life. However, for some people, it can become overwhelming and interfere in recovery. Here are some ways that you can help a person to adjust following stroke. One way you can help is to encourage the person to do things they enjoyed before the stroke, such as reading, watching TV, or listening to the radio. Helps to keep the mind active and to focus on other things. Make sure the patient is not confined to his room alone. Instead, encourage them to move to other rooms, balcony or verandas, if possible, in a wheelchair or with assistance. Maintaining contact with friends and relatives is important. People can be anxious at first about whether their relative will be okay and have everything they need. You may need to plan ahead and allow more time, as the person may need assistance, but it is very important. Maintaining social contact has a very positive effect on recovery. Rest is important. The person affected by stroke can tire much more easily and may need to rest more. Looking after someone with a stroke can be rewarding but tiring. Speak with friends and relatives and take a break if you can. Seek support. Speak with relative and friends and take a break.